Okay, as I mentioned, these questions are going to be just like the ones that were in Evolve. I just changed the questions just because the Evolve questions aren't mine and I can't put them on YouTube. So I just made these up, but it'll give you an idea of what the questions are like. Number one, the FDA recently expanded the caution about taking fluoroquinolone antibiotics. You can recognize these medications by their fluoxetine stem. If the FDA put out another warning about a generic medication, you know the name must be. And so this question isn't really asking about antibiotics. We haven't gone over antibiotics yet. What it's really saying is, which one is the generic name? And there's a couple of ways you could handle this. Generally, generic names are 4 syllables or more. Generic names are going to have a stem that you recognize. Or brand names are going to be about 2 syllables, sometimes 3 syllables. And so we have 3 very common brand names here. Tylenol, Cipro, Motrin. Let me undo that so it's not goofy there. But then amoxicillin is clearly a generic name. So a generic name, and it has this cillin stem. So this would be the correct answer. Number 2, just to show you again, it's just a fake question, but patient expects to start opioid treatment for severe pain. You know, opioids cause significant gastrointestinal slowing. Which would be the best choice? And you can answer it one of 2 ways. You can cross off the ones that are not right. So this is 0.9% normal saline, so we're not going to give them normal saline for some kind of constipation. Docusate sodium, this is a stool softener, and that's something that we've talked about. Lactulose, this is for ammonia, usually with patients that have some kind of ammonia buildup because of liver disease. So we want to be able to get them to ammonium, and lactulose does that. And then polyethylene glycol. This might have been it if it was Miralax, but this Go Lightly is that big plastic tube, or big plastic jug. It's about a gallon of electrolytes. So this is for bowel prep. Okay. So polyethylene glycol for bowel prep, lactulose for patients that have liver conditions. Normal saline is just detractor. So docusate sodium looks like the right answer. The other questions are a little bit different. And the reason I do it this way is to be able to return exams more quickly rather than trying to answer, checking to see if the answers are right, 25 times, whatever the number of students are in class. So if we look at the questions from 26 to 50, I just made up 10 questions, but what's the study of drugs? So study of drugs, pharmacology. This is answer D, okay? And so the answers are up here, A through E, and then the actual answers are here too. I put them all down here. What kind of condition is gout? It's an arthritic condition, so that would be A. What kind of subjects will be found in phase 2 clinical trials? So phase 2 is when patients come into the fray. So patients are here in C. Number 4, what neurotransmitter suppresses migraine? You can use serotonin receptor agonists. What opioid receptor is related to physical dependence? That'd be the mu receptor, Mu. Let's see. When blank is depleted from acetaminophen's minor metabolic pathway, hepatotoxicity occurs. And it's telling me I spelled toxicity wrong. Understandable. And that's glutathione. So that would be B here. When a response to a drug is rapidly reduced through tolerance, this is considered what? And it probably should be like something like that. And that's going to be tachyphylaxis. Where is it? Here. Okay, so tachy means fast. Phylax means to protect, so quick protection of the body against some kind of insult. That would be number 7, D. Which first generation non-aspirin, non-steroidal anti-inflammatory drug has a plasma half-life that's about 20 hours? So if we're talking about a half-life that's 20 hours, it's going to be the longest acting one. And the longest acting NSAID is meloxicam. That's C here. And then which is an acronym for cyclooxygenase 2? So COX2, COX2. And which NSAID is an irreversible inhibitor of cyclooxygenase, and that's aspirin, That's how it affects the platelets. So this is where it was a little bit tricky. If you have aspirin and maybe there's some other word that's like it and they're both A's, well, it's not hard. A just is the answer. But I may need to separate it. So for example, if I want to test to see if you know the difference between what COX-1 is for and what COX-2 is for, I'll put everything in alphabetical order here, A through D, and then everything in E by itself in alphabetical order. This way, meloxicam is long-acting, but naproxen is not quite as long-acting, and those would have been both in C alphabetically, so not much of a challenge. So I need to separate them as C and E. I need to separate COX-1 and COX-2 as A and E, then aspirin, and I don't know why I put that one over there. There's not really another one like that. And then pharmacokinetics versus pharmacology, D and E. So this is alphabetized A through D, and if the answer is there, great. But the answer might be over here in E if for some reason there's something that's close alphabetically that would have taken away from the challenge.